As a dentist, you are not qualified to tell a patient that everything is fine, at least not without a proper exam and a system behind it. This realization hit me hard because for years my exam was too basic, it was costing me money, and it was harming my patients long term. Let's walk through how to do a proper exam to both benefit you and your patient's health. I was sitting at a course in the Coy Center in Seattle, Washington, and a mentor came up and informed us, do you realize how much information you would need to gather on a patient to tell them that everything is fine and healthy? It's an immense amount. It's overwhelming. In this moment, I realized the exam that I was performing was really providing no way for me to tell the patient that everything was fine, everything was good, they were in perfect health. But I still said it anyway. My old exam, it was tooth by tooth. Quick glance at the perio chart, glance at the x-rays, get in there, check around. Really no look at their airway health, their TMJ, asking them about significant things in their medical history, considering the mouth as the gateway to the body and the oral systemic connection. I was just breezing through. Honestly, it was more transactional than anything. I was rushed. I was seeing volume, but I wasn't actually helping anybody. Once I came to the realization that my exam wasn't helping anybody, I came to a realization that the problem wasn't me. The problem was this sort of speed culture. Once I realized that I was doing tooth-by-tooth dentistry, I realized that tooth-by-tooth dentistry caps both your income and your impact on your patient's health. When I structured my exam differently, everything changed. I stopped going tooth-by-tooth, just scanning for obvious problems, and I started actually screening for ideal health. We started looking at their TMJ, their head and neck, their soft tissue, obviously looking at their teeth and gums, but what are underlying problems that might be affecting those? We started screening for airway issues. This was huge. Once we started screening for potential risk of things like sleep apnea and sleep-related breathing disorders, we started finding 1 to 2 patients a day that tried CPAP and failed, that were sleeping horribly but didn't know what to do. We got them in touch with physicians, with my colleagues. We got them taken care of and treated. And this is not hyperbole. We likely added 7 to 10 years of life to these patients. That is not an exaggeration. That's a huge impact. Remember when I told you that you need a system? Well, the system that you need is a comprehensive exam template. When you followed a structured process, you can confidently say, everything is fine, or this needs attention. Patients will start telling you, I've never had a dentist talk to me about my health this way. They'll start telling their friends. You'll start collaborating more with the medical community. Likely many of them will become your patients. This will tell you everything. When you stop becoming a tooth mechanic and you become a collaborator, your career is going to blossom. When it comes to implementing a system to do a comprehensive exam, there is no greater tool than Oryx dental software. Oryx has been instrumental in the success of our practice by building a culture around the oral systemic connection. The good news is they make it super easy. We have a comprehensive exam that is a checklist form that we're able to follow step by step. At the end of that exam, we have a complete summary that we can show to the patient and any of their medical providers. It has helped us build authority in our community and build a reputation of being a systemic and holistic provider. If you want to be able to implement a comprehensive exam in an easy way that can be done in under 10 minutes, then you got to check out Oryx. Check out the link below to book a free consultation and find out how they can help you elevate your practice. Here's what changed. Higher collections without seeing more patients. More referrals, more collaborations. The collections increased because the value that we were providing was clear. I thought that I needed to see more patients, but no, I just needed a better exam. And when you do a comprehensive and thorough exam, patients that value their health are going to want to come and see you. And patients that value their health are going to invest in comprehensive care. If you are chasing volume, you are simply inviting more stress in. You don't need more patients. You need a better exam. An upgraded exam is going to upgrade your team buy-in, it's going to upgrade your income, it's going to upgrade your case acceptance, and it's going to upgrade your quality of patient. You don't need more patients. You just need a better exam. If you enjoyed this video and you want more practical strategies like this on how to build your authority, increase your reputation, and increase revenue in your practice ethically, then stay tuned. We're putting out content every single week. Don't forget to check out Oryx in the link below, as they are a dental software company that is going to help you elevate your practice and especially elevate how you perform your dental exam. Thank you so much for watching. Stay tuned. See you next time.